Hi there, Dr. Tansavatdi here. Today I'll be answering a question that I get asked a lot, and what that question is what is the difference between a SMAS lift and a deep plane facelift? A lot of my patients have figured out that I do prefer to choose a deep plane technique, although I have been trained with both techniques, and I'm going to go over the difference between the two. First, going over the differences requires me to define what the SMAS layer is. What does SMAS mean? SMAS is the superficial muscular aponeurotic system, and it's the muscle layer beneath the skin, right under the skin, that envelops the whole face and what is lifted to address the jowls and everything else in the face. So that muscle layer is separate from the skin when we do a SMAS lift technique. So the skin is lifted a long distance and separated away from the muscle that's underneath, the SMAS muscle, and then the SMAS muscle is lifted separately, and then the skin is placed back down. The problem with this technique is that there's a long skin flap, so the blood supply can be disrupted to the very end, so you can get a risk of skin necrosis, and you can get unnatural sweeping effects when the skin is laid back down. So the way the skin lays back down can cause effects, contour regularities, disruptions, and so it looks less natural when we do the lift. The other problem is a SMAS technique, the muscle is lifted only a short distance, so it might just tighten a small area, but it doesn't get to the very deep portion here. In a deep plane technique, the skin is elevated a short distance, so a short distance like this length, and then the muscle is entered, and so the skin and muscle is lifted together as one flap, and then we go underneath and lift all of this fat pad, the jowl fat pad, the malar fat pad, and that's all lifted up. In order to do so, to get all the way into the deep portions of the face, the ligaments have to be elevated. So these are ligaments that attach the muscle to the bone and the skin up above. So those ligaments are released, and so it allows us to lift the muscle to its best extent. And so that's where you see a more natural, elevated appearance with the deep plane technique, where you can really address the marionette lines and the nasolabial folds. So there you have it. That's the difference between the two techniques and why I prefer to choose a deep plane technique in most of my patients.